Well, the cardiovascular services here at West Penn Hospital are critical for the rejuvenation of this hospital. Now, paramedics and patients can now come here for their cardiovascular disease. They can have emergent catheterization, even routine catheterization, as well as surgeries for electrophysiological problems like atrial fibrillation. The full gamut of services are now available at West Penn Hospital in cardiovascular.
So now that the cardiac cath lab is back open at West Penn, patients in this area can get into a lab much more quickly than having to be transported further away. That could make the difference on the quality of life the patient has going forward.
As a paramedic, I'm a patient care provider. I still work on the truck. Going into that cath lab, just feeling the excitement of the staff there. The facility is state-of-the-art. Everything is brand new.
It was important for us to come back and serve this community and move this heart program forward into the future.
Standard of care now is moving to what we call E to B time, first medical contact or EMS contact to balloon time in 90 minutes.
The EMS is well aware that it's no longer the door to balloon time that matters. It is the first medical contact, so the clock starts there.
If you take it from the patient's perspective, you want to reduce the time from when their symptoms start to the time that they actually get artery opening therapy. That's what we want. The focus initially was on from door to balloon, but that's really what happens in the hospital. We actually want to extend it to before that.
What we're doing, and not a lot of the other hospitals do, is we're going to let the paramedics activate the cath lab from the field.
We need to get paramedics who are trained, equipped at the bedside, transmitting the 12 leads for patients that have acute myocardial infarction, because that'll make the whole system go faster.
We're trying to empower the paramedic to make the clinical decisions that we know that they're capable of making.
They activate the cath lab. Ours is a very unique system in which all of the constituent hospitals of the Allegheny Health Network have said that we are going to empower the paramedics to make the decision and empower them to call the cath lab.
And we're committed to doing that and being part of it and investing in training the pre-hospital care providers. Only when we work as a system from the patient's bedside all the way to the cath lab will it be the best. This is a rebirth of what was great here at West Penn Hospital.
The physicians that we have, the nurses that we have, the coordinators, the techs, everybody is excited to be there, and they're the best of the best.
We have the most advanced cardiac catheterization lab in Western Pennsylvania. We now have the capabilities. We understand the benefits of having a well-trained EMS team that's part of it. It helps patient outcomes, and we're going to work together.
We can't do this without them. This whole initiative to provide the best patient care